members, audience members, members of the committee. It's Wednesday, March 19th. A quorum is now present, and the Minnesota Senate Education Policy Committee will come to order. Today we have a very full agenda, and so I'd appreciate it if all testifiers could be as short, sweet, and succinct as possible. I just want to give a shout out to my colleagues on the other side of the aisle. I'm not sure if you're aware or not, but tomorrow's the anniversary of the founding of the Republican Party. And in 1854, the Republican Party was founded in my home state of Wisconsin. And so I'm looking forward to the cake that you guys are providing in the retiring room tomorrow. Not sure if you're aware of that yet or not. So anyways, when I was still teaching, I preached a lot about the importance of the two-party system. And I believe with every fiber in my body that what made, among many things, but one of the things that made America the bastion of hope that it is for the world is a strong, stable two-party system. And if we're not a strong, stable two-party system, things can kind of fall apart rather rapidly. And so I appreciate and respect being a citizen in a nation with a wonderful two-party system that we've come to most oftentimes, but not all the time, love and admire and respect. And so thank you all members of whatever party you belong to for the work that you do for your party. So with that said, today we have a number of bills, and the first bill up is Senator Boldon's 1354 on school health advisory, and we will be sending that to state and local government. So whenever you're ready, Senator Boldon.
Thank you, Mr. Chair and committee members. I'm grateful to be before you with this bill. I will be concise. Senate File 1354 would create a school health advisory committee, which would advise the governor and us, the legislature, on policies and practices related to school health. The committee would advise and recommend policies that are effective in safeguarding and promoting the health of children at school, prevent health barriers to learning, include evidence-based school nursing and health services, and align with the standards of practice of school nursing. Members, a lot of bills come before us related to the health and safety of students. We've heard a number of them already this session and in previous sessions, and not all of us are health experts. We bring a variety of background and expertise with us to the legislature and cannot be an expert on all things. And so the goal of this legislation would be to create that advisory board of those who are experts and who would be able to then advise us to be sure that the policies that we enact are done so successfully, would give us things to think about, would have that expertise that not all of us do, to be sure that the policies that we pass are implementable in the best way possible. So with that, I will hand it over to testimony, Mr. Chair.
Begin and identify yourself for the record.
I believe that Tara Cliff is going to be testifying first.
You are correct. Thank you. Tara Cliff, you're remote. Identify yourself and begin your testimony.
Good afternoon, Mr. Chair and members of the committee. My name is Tara Cliff, and I'm the president of the School Nurse Organization of Minnesota. And I'm here today to ask for your support on Senate File 1354 on the establishment of an interdisciplinary school health advisory committee. In today's evolving education environment, we are seeing increased concerns related to student health, such as managing acute and chronic health conditions, supporting students with medical fragility, and addressing mental health issues. The landscape of school health has been further complicated by the rapidly advancing technology and the need for well-crafted plans of care for vulnerable students. We are seeing this currently with stock epinephrine in schools. Our current laws support epinephrine auto-injectors, most commonly the EpiPen, but now we have new technology and new delivery systems that are allowing to give this life-saving medication nasally, which is wonderful. But our legislation is currently for the auto injectors. And so just looking at that further is maybe a change in language to encompass that change in technology. In recent years, we've seen bills proposed related to stocking naloxone in schools, AED and cardiac response, and seizure training for all staff. All great things. But one of the more critical factors is ensuring a safe and healthy learning environment and the ability to make data-driven decisions. So a state advisory board could serve as a central body to review that health data and assess current health advancements to create policy recommendations before reaching legislature or legislators, which would allow them to act swiftly and with well-vetted recommendations and solutions on evidence-based school nursing services. It would also develop best practices for schools and support schools who may not employ a school nurse. Recommended strategies to manage chronic conditions, mental health concerns, and other medical needs. To focus on creating comprehensive care plans that are adaptable and sustainable, particularly for schools with limited resources, and address the growing issue of chronic absenteeism, which is often tied to undiagnosed or poorly managed health conditions. So by supporting this initiative, we can ensure that every student has access to the care and support that they need to thrive academically and physically. The Student Health Advisory Committee would be instrumental in driving these changes through evidence-based recommendations and continuous improvement on our state's educational and healthcare systems. I respectfully ask for your support in advancing this critical initiative for the well-being of our students, and together we can create a healthier, more supportive environment for our children and ensure they can succeed in school and beyond. Thank you for your time.
Thank you. And the next testifier?
Good afternoon, Chair Dwozinski and Senator Boldon. I am Ruth Ellen Lear. I am a registered nurse, a licensed school nurse. I have my doctorate in nursing practice, so you can call me Dr. Lear, Dr. Nurse Lear. I have two brothers who are physicians. We always need to clarify that. I worked for 30 years at the Minnesota Department of Education as the schoolhouse services specialist, part-time. We always had additional programs, and over the years, I had the opportunity to work in areas of early childhood screening, AIDS, HIV, Operation Military Kids, which was to support children who were in families where there was the National Guard, homeless education, emergency preparedness, special ed. These are all areas that school nurses also work in, along with their other student services specialists. Once I retired, I then taught public health nursing part-time at Metro State University. And there really got to understand clearly that the baccalaureate degreed person who is, what is the criteria for being a licensed school nurse, is essential for managing the health of children. This particular bill would help us get a coordinated umbrella approach to the many and variable factors that Ms. Cliff was just laying out for us. Right now, we have in Minnesota Statute 121A.21 the requirement for school districts to provide services that promote the health of the children. What does that mean? And how does it relate to their education? This advisory committee would offer the groundwork, the framework, and the scientific evidence to flesh out what that could mean so that there would be some consistency across the school districts, and so that we would make sure that all children have access across the state to schoolhouse services. We do not have equal access right now because there is such variation in how the schoolhouse services are applied. And one of the dilemmas is that when children have unidentified and unaddressed health needs, can they really achieve the goal of having a free, appropriate public education? There are many elements of the bills that you have already heard and that you have authored, including there's some good strategies that are already in place in the Minnesota Rare Disease Advisory Committee. You ask for the latest, most current scientifically available information. And the other bill that I saw has some relevance here is the Safe and Supportive Schools programming, where we actually ask for a plan from school districts. We review the plan and then give feedback to you, the legislature, and to school districts too. All of those things are the elements which would help us have a better, safe and secure, in terms of health reasons, schools for our children. Thank you for the opportunity to support this bill. I appreciate it.
Thank you, Dr. or Ms. Lear, whichever you go by. Members, questions? Senator Duckworth.
Thank you, Mr. Chair. Just two quick ones for Senator Boldon. Is there a cost associated with creating this committee? And then will it have rule-making authority, or is it purely advisory? Thank you.
Thank you, Mr. Chair. Thank you, Senator Duckworth, for the question. We do not yet have a fiscal note, and it would be advisory.
Senator Wiesenberg.
Thank you, Mr. Chair, and this would be for the author as well. On page 3, lines 3.2, number 16, where it says 4 legislators, 2 from the House, 2 from the Senate. Would you be willing to say 1 from each party? So there's representation from both sides, as Chair Swedzinski just said, is very important.
Mr. Chair, Senator Wiesenberg, yes, thank you for that question. That is the intention, but would be helpful to spell that out. So I'm happy to make that clear as we move along the path. Thank you.
Thank you, that's all.
Thanks for that observation, by the way. Senator Abler.
Yeah, thanks. And just to the whole thing of it, you know, I think it's, well, I'm just going to say it's aspirational. I just want to caution you about the scope of it, what you think you're going to accomplish. On line 2.1 and then 2.6, this committee must establish a safe, effective, and coordinated model of school service for children with chronic and acute health conditions. I think if I'm just going to go back to my good superintendent, the head of superintendents now, David Law, what is the job of the school? And just to caution you that taking on this responsibility is a massive responsibility. And it's just, if you're really going to do this, I think you want to consider assisting and supporting efforts, but this is requiring, I've been on these kind of task forces and like, well, what's our charge? We must establish this model, which I don't even know if every clinic in Minnesota would agree on the model that would be serving these individuals, much less a school advisory thing. And another one, that's about the coordinated care between medical and healthcare systems and schools. The timely communication makes sense, but you're going to boil the ocean here if you really think you're going to do this. And I mean, it sounds nice, like what we did, if you think the schools are going to do any of this, they can barely teach their kids to read and do math and get them to go to school and try to find a way to make the school lunches, appetizing. So, I would actually encourage you to look at this and chat with some people that have actually doing something like this and make it a small scale and figure out what it is you're not accomplishing, and then work to accomplish that. What parents don't think their child was well served at a school, both for mental health needs and they hardly can afford to have a school nurse anymore, much less have this whole program. So anyway, there's like no money. But it's good to bring the idea forward, and I think if the theme is we need to find ways to make sure our students are supported with their particular illnesses, either a physical or a mental illness in a school, that's a really worthy task. So that's my encouragement to you to actually go home with something. Thank you.
Members? Well, thank you, Senator Boldon, for bringing this bill forward. I do have maybe something to think about in the bill. I noticed that there's not a student among the list of people that we'd like to on this panel. And I don't know if you'd entertain that idea or whatever, but I just think it's nice to see a student representative on educational committees that we create. And then the other thing, it brought a smile to my face, line 1.11, effective and safeguarding promoting the health of children at school. And I can't tell you the number of times I went to the school nurse as a teacher, and I think most teachers would say the once a year or so that they visited the school nurse for some sort of advice on whatever, because of a health issue they may be facing. And don't add that to the bill. Because maybe teachers don't want to be known that they go see the nurse when they have something they want to discuss as well. But thank you for bringing the bill forward. I thank both testifiers. And so the bill, we will be voting to send it to state and local gov. All those in favor, say aye.
Aye.
All those opposed? Bill passes. Thank you. Next up, Senator Maye Quade. Senate File 2250.
Okay. Thanks, Mr. Chair. Okay. Are we on 2250? Okay. Good afternoon, Mr. Chair, members. Before you is Senate File 2250, which aims to bring flexibility and clarity to our education system by defining what hours of instruction are in our secondary schools. Despite repeated use in Minnesota statute, the definitions for hours of instruction is non-existent and can restrict student learning opportunities. This bill empowers districts to innovate by expanding what they count as educational experiences to include things such as internships, apprenticeships, and other project-based learning opportunities that are supervised by qualified teachers and allow students to earn academic hours. By focusing on secondary schools, we aim to equip students with personalized and meaningful learning experiences that foster engagement and reduce problems such as absenteeism. Providing personal learning environments increases student engagement in learning. By defining hours of instructions to include these expanded learning opportunities, students are able to explore relevant interests beyond the traditional classroom setting. And I'm excited to turn it over to my testifiers who can tell you more on why you should support this bill.
Thank you, Senator Maye Quade. And we do have a series of testifiers, so if you want to make your way up to the table, Julian Spencer, Sherelle Edwards, Sarah Baccia, and then followed by Patrick Walsh remotely, and then we'll get to the last two when you guys are done. Begin when you're ready. Identify yourself for the record, and
Sounds good. Good afternoon, Chair Swazinski and members of the committee. My name is Julian Spencer. I'm 21 and a proud graduate of North High School in Minneapolis. I help lead a new initiative called Good Trouble, where we support many young people in the Twin Cities who have struggled to find motivation and purpose in conventional schooling, and who, like me, sometimes get into trouble outside of school. I'm here today because Senate File 2250 would remove a key barrier preventing schools from providing more motivating learning experiences. This bill would allow schools to count real-world learning like internships and apprenticeships as instructional time, keeping students engaged while maintaining academic integrity. I'm here because I was very unmotivated and disengaged in my middle and high school years. Like a lot of other people, young people, I felt like schools were not for me. Too many young people in Minnesota are disengaging from school, in part because the old classroom textbook model fails to meet their need for real, purposeful work skills and experience they see as relevant to their future. I know firsthand how a lack of engaging learning options can push students away from school. As a sixth grader, I went from the classroom to the courtroom. I spent the next few years getting into trouble on the streets and in the justice system. Becoming a father at 16 sparked my desire to be a role model for my daughter and helped me find my purpose supporting other youth to avoid similar struggles. Many of my friends and classmates weren't so lucky. Right now, Minnesota's lack of a clear definition of instructional hours is a barrier preventing public schools from providing more flexible, real-world learning experiences that could keep students like me engaged and motivated. SF 2250 would clarify this definition, allowing schools to expand learning beyond the classroom model while maintaining oversight and student protections. We know that when young people don't find purpose in school, they find it elsewhere, on the streets, in unhealthy online spaces, or disengaging from education altogether. We know that learning happens in many ways, not just through lectures or seat time. In places like North Minneapolis, young people are hungry for internships, apprenticeships, project-based learning, and other engaging learning experiences outside the classroom. SF 2250 would encourage districts and schools to use innovative ways of meeting student needs, motivate our learning, and prepare us for bright futures. Student disengagement is a crisis in Minnesota and across the country. The time to act is now, and SF 2250 is a major step forward. Thank you all for your time and support.
Thank you.
Good afternoon, Chair Swazinski and members of the committee. My name is Sherelle Edwards, and I'm a 17-year-old junior that attends Exploration High School, located in North Minneapolis, where I was also born and raised. I was raised in a home where academic excellence was highly valued, which allowed my enthusiasm for knowledge to grow as I got older. However, I went from being an honor student in elementary school and middle school to almost failing ninth grade. My academic needs were not being met, and over time I began to lose motivation and my love for learning. Frustrated with the lack of progress and seeking a better education, I transferred to Exploration High School, a public charter school that emphasizes personalized learning tailored to the needs of individual students. In this environment, I had better relationships with my teachers and overall had a better high school experience. I was introduced to numerous opportunities that led me to discover my gift for supporting and advocating for youth, as well as my deep passion for it. One of my experiences that has shaped me was a fellowship with Uptake, a Minnesota-based nonprofit news organization. During my fellowship, I spent a lot of time at the Capitol. I learned how laws and policies are made, as well as how to be a journalist and create unbiased reports and events. I also developed skills in research and storytelling and advocacy. My fellowship provided learning opportunities beyond the classroom and often outside the school hours, yet I still earned civics credit. Another credit-earning opportunity I had was a 7-day visit to historically black colleges and universities, also known as HBCUs. During the trip, I explored the rich history of the cities I visited and also gained insight into the legacies of HBCUs. I also had a chance to visit the National Museum of African American History and Culture, where I engaged with stories and perspectives that are often absent from traditional classroom lessons. This experience was both an eye-opening and impactful, and it took place outside the regular classroom day and hours. These unique experiences reignited my passion for learning. More Minnesota students need opportunities like these to stay motivated and engaged. I want to be an example of the positive impact Senate File 2250 can have on students like me. I believe this bill will encourage and empower districts and school students to adopt innovative strategies that address student needs and inspire their learning and equip them for the future. Thank you.
Thank you. Is there another student testifier? Okay, thank you. Can we get another chair up there so the three students are up there?
I can move, Mr. Chair. I can let the students take
I-
the table.
The page has it. Thank you, Senator. And then we'll generally, usually, well, whatever, today might, anyways, I was going to suggest when the three students are done testifying, if the members of the committee have any questions specifically for the students. That's why I want all three of you up there for now, so thank you.
Alrighty. Thank you, Chair Swadswick, and members, Swazinski and members, so sorry. Thank you for having me here today. My name is Sarah Basha. I am a 2024 graduate of Minnesota Public Schools. I am here because I believe Senate File 2250 will help young people become better prepared for our futures and clearly defining the school district that can become more student-centered through the education experience that they provide. In December of my freshman year, I had lost my mom. This was devastating to me. I missed 2 months of school and I struggled to get back on my feet due to depression. And I was able to get back on my feet because of a mentorship called Girls Taking Action. This program taught me work skills and communication and ways to organize myself, not only educationally, but with college readiness. I wasn't eager to learn about school anymore due to the regular school system, but Girls Taking Action empowered and motivated me each and every day to remember the skills that they provide in school are better handled in the context that clearly is related to my life. When I was with Girls Taking Action, this was a program that set me up for several paid internships, work experience that taught me education, but taught and was experienced by educators outside of the school system. Girls Taking Action was a class that didn't earn me a credit towards my graduation, but they also helped and saved my life. And at the end of my junior year, I found out that I wasn't on track to graduate because I had classes that I had missed due to the loss of my mom. Like other students, I was encouraged to transfer to an alternative school that was more flexible. If the changes proposed in House or Senate File 2250 were in place, my high school experience might have been a little bit different. I might have been able to earn my credits towards graduation with Girls Taking Action, which left me more motivated. I am one of those who struggle to be motivated in schools, but on a national level, there's a study that says 66,000 middle school and high schoolers from the Booking Institution reported less than half of their students felt they learned a lot. Less than 1/3 of them Thank you for listening.
Do you want to take a second? You can and finish. Feel free.
Take a deep breath.
Yeah, you're doing great.
Members, any questions for the students?
Just to clarify for the record, I am a recent graduate, not a student. Just to clarify.
Duly noted. Thank you. Congratulations as well.
Appreciate it.
Well, I just a comment, if none of my colleagues have a question. I just thank you, the three of you, for coming in today. We appreciate it. I love hearing from students and former students, recent graduates. You had said you lacked a sense of purpose, and that was one of the things that's a common theme among many youth today, is they don't have a sense of purpose, and if we can help provide them with that, and one of the things, and those of you that know me well know probably what's going to come out of my mouth right now is I would tell my students to not let school get in the way of their education, and it's something I truly believe is there's a lot of learning that goes outside of the cells and bells of the classroom if we take advantage of it. So I just want to thank the three of you for your testimony today, and if we don't give our youth something constructive to do, they're going to find something destructive to do. And so thanks for coming in. Senator Miller.
Thank you, Mr. Chairman. I just want to thank our testifiers for coming in today. It takes a tremendous amount of courage for students and recent graduates to come in front of a committee like this, and you all did an outstanding job. So thank you for being here today.
And you pronounce my name great, and I had students after 9 weeks that couldn't pronounce it, so thank you for that, and I echo what Senator Miller said. So, Senator Wiesenberg.
Thank you, Mr. Chair, and I think that probably would be for Senator Maye Quade. So I know like when I went to high school, we had OJT, like on-the-job training, and we got credit for that. So is this expanding on that? Is there some reason kids aren't getting credit for that? I guess I'm just trying to understand why they wouldn't get credit for something like that, or what's going on.
Thank you, Mr. Chair and Senator Wiesenberg. I do have a few more, a principal, superintendent, and a policy director who can also talk a little bit about what this will change. But I think, I think right now the way that it is it's kind of like a nose in seats type counting. And there's so many places that kids learn or young people learn. It could be at internships, it could be in programs, but, one of the most instructive things I did when I was in school was not in a classroom. Going to the Holocaust Museum was so different than learning about it in a book. And so being able to have a qualified teacher kind of describe or help define, this learning experience was a learning experience, even if we didn't do it in a classroom.
Thank you.
And Senator Wiesenberg, I think we have 2 more testifiers, so feel free to bring it. Okay.
3 or 4.
Thank you.
Thank you, all 3 of you. So Patrick Walsh is remote, and then followed by Jeff Pollack and Akila Robertson. So Patrick Walsh.
Patrick Walsh is remote, Mr. Chair.
Pollack, we'll see if Patrick Walsh shows up, but anyway, when you're ready.
Sure. Okay. Sure. Well, Chair Zawodzinski and members of the committee, thank you for the opportunity to testify in support of Senate File 2250. My name is Jeff Policki, and I've been an educator for 25 years, with 18 of those years as a high school administrator here in the Twin Cities. For the past 9 years, I've had the privilege of serving as the principal at Shakopee High School, which we also refer to as the Academies of Shakopee. And that is one of 2 high schools in the state of Minnesota with wall-to-wall academies and part of a nationwide network of academy high schools. In today's rapidly evolving world, the traditional model of education, where learning is confined to a rigid schedule and seat time within school walls, does not fully align with the needs of today's students. Learning simply does not turn off at 3 p.m., nor does it happen solely within a classroom or while seated neatly in rows sitting at desks. Our goals should be to create experiences that reflect the world students will enter after graduation. And that is why Senate File 2250 is so important. This bill provides much needed clarity by defining hours of instruction as educational experiences that allow students to earn academic credit are available to all students and are supervised, coordinated, and verified by a qualified teacher. It also defines educational experiences to include a broad range of learning opportunities approved by local school boards. But most importantly, it ensures that students maintain access to the supports that they are entitled to under state and federal law, regardless of how or when they meet their instructional requirements. Through our academies of Shakopee, students engage in authentic, hands-on learning experiences with our community partners. We have students working in capstone experiences at St. Francis Regional Medical Center right in Shakopee, Canterbury Park, the Shakopee Mdewakanton Sioux community, the city of Shakopee, Scott County, Entrust Data Card, Hometown Bank, along with many other external partners. These experiences extend beyond the walls of our traditional school day and provide students with real-world applications of their learning. This model has proven to be a powerful tool in boosting student engagement and achievement. There's research that shows that students are most engaged when learning is relevant, hands-on, and connected to their interests. A recent survey of Generation Z students found that they are most excited about school when learning about topics that interest them and when engaging in hands-on learning. Expanding instructional hours to include personalized and competency-based learning opportunities such as internships, service learning, project-based experiences can improve student achievement and reduce chronic absenteeism. Data from other states such as South Carolina and Ohio demonstrate that personalized learning approaches lead to measurable improvements in student attendance and engagement. And just in Shakopee, we have seen gains in our overall graduation rate over the course of the last 5 years. Senate File 2250 does not impose new mandates or requirements on districts. Instead, it empowers districts with the flexibility to design learning experiences that best meet the needs of their students. Schools that wish to continue with traditional models may do so, while those seeking to innovate will have a clear statutory framework to support their efforts. Furthermore, this bill maintains funding consistency by ensuring that pupil units remain unchanged, preventing unintended financial consequences for school districts, creating innovative, authentic learning experiences for students. It also establishes a process for periodic policy updates to ensure that state regulations do not inadvertently constrain innovative educational opportunities. By passing Senate File 2250, we can support Minnesota districts in expanding opportunities for students while maintaining quality, accountability, and access for all learners. Our hope is that this legislation will allow more schools to implement successful models like the one that we have developed in Shakopee, deepening student learning, expanding access, and preparing students for the realities of the modern workforce. I urge you to support this bill and help create a more flexible, engaging, and meaningful educational system for Minnesota students. I want to thank you for your time and consideration, and I'm happy to answer any questions you may have.
Ms. Robertson?
Thank you, Mr. Chair and committee members. I am Dr. Akila Roberson, Policy Director at Education Evolving, an organization that drives transformational, student-centered designs for learning. Thank you for this opportunity to testify in support of Senate File 2250. Booker Teleferro Washington once stated that success is not to be measured so much by the position that one has reached in life as by the obstacles he has overcome while trying to succeed. This bill encompasses the necessary components to help our students overcome and acquire practical success in their educational and professional pursuits. Education Evolving was deeply involved in the formation and application of the Innovation Zone's work from 2012 to 2017. Innovators regularly identified instructional hours as an area where flexibility is needed to truly serve our young people, thereby creating rigorous, engaging, and real-world learning opportunities. HSF 2250 addresses this need system-wide. The trailblazing leaders who created it sharpened the focus, flexibility, and when learning occurs. There are many benefits to students learning outside of the traditional school setting. Research shows student connectedness to curricula improves overall attendance, test scores, and a sense of belonging. And practically speaking, students spend only 20% of their waking time annually in formal classroom education, and the remaining 80% exploring learning interest in non-school settings. With the flexibility of instructional time, schools can maximize their engagement with students through internships, service learning, and other programming. In closing, this bill provides a platform for students to demonstrate knowledge, skills, and talents which might get missed in traditional academic settings. I leave you hope. I leave you a thirst for education. I leave you respect for the uses of power. And finally, I leave you a responsibility to our young people, as spoken by Mary McLeod Bethune. Thank you.
Members? Senator Duckworth?
Thank you, Mr. Chair. I appreciate it. Just a question for Senator Maye Quade, if that's right. I think if I read the bill correctly, the ultimate sort of determiner of what qualifies or how this would be implemented in a particular school district rests with the school board. Is that correct?
Mr. Chair, Senator Duckworth, I believe where are you looking that you see that? Because what I'm seeing is that it has to be supervised and coordinated and verified by a qualified teacher.
If I may, Mr. Chair. Sorry, I should have been more helpful. Lines 2.4 and 2.5 talks about to be included, the credit to be included, or the instructional hours in any secondary school course of study prescribed by a school board, and then it gives under a particular section. So really, I'm just trying to understand that if we're going to allow for this flexibility or give change to the definition of instructional hour, it's still going to be sort of a case-by-case. School boards will determine what qualifies, what they're comfortable with, how they're going to oversee and supervise that.
Mr. Chair, Senator Duckworth, yes, thank you so much for pointing my attention there. And yes, I think our Shakopee testifier gave a really great examples about what it's like in Shakopee. A little bit different than ISD 196, but school boards are best able to handle that.
Very good. Thank you.
Senator Boldon.
Thank you, Mr. Chair. Thank you, Senator Maye Quade, for bringing this bill. I appreciate it. There are many ways to learn that don't all happen within a classroom. I think back to when I was in high school a long time ago. There was a program where I got credits for training to earn my CNA and then working as a CNA in a long-term care facility. And I didn't know it at the time, and it wasn't my original intention, but that was the first step in me becoming a nurse, something I didn't know that I wanted at that time. And so appreciate, in my view, this sort of expands opportunities for people. And you know, with potentially long-term consequences. And so thank you. And also just want to echo a thanks to the students and former student who are here to testify. Thank you for bringing your voice to this as well.
Members, anybody else? Thank you, Senator Maye Quade. I think you know how I feel about this particular issue, and so thank you for bringing this bill forward. Principal, I'd like to have Sarah Jordan reach out to me, tell her I said hi, and I'd love to visit your school this fall if the time allows, because I think what you guys are doing in Shakopee schools is something maybe other members of the committee may want to join me in visiting your school. So I'd like to experience that.
Well, Mr. Chair, anytime, and Sarah is holding down the fort at the school right now, but I can tell her you say hi.
Yeah, I'll have to text her and see if she got more gray hair today. So we're sending, okay, this bill will be sent to Ed Finance. All those in favor of sending this bill to Ed Finance, say aye. Aye. All those opposed? Motion carries. Thank you, Senator Maye Quade. I think you can, and thank you, testifiers. Hey, wait, sorry, ma'am. The Mary McLeod, how do you say her name?
Mary McLeod Bethune.
Okay, her statue in D.C. is my all-time favorite statue. It's in Lincoln Park. It's off the beaten track. It's not on the mall where everybody sees it, but I love that she's holding a book out to those 3 kids that are circling her, and I just think that's one of the great, they should move that statue to the mall so more people can be excited about learning about her story and her impact she had on education. So I applaud that you quoted her, Ms. Robinson.
Yes, sir. Thank you.
Am I staying here, Mr. Chair?
Yep.
Great.
Next up is Senator Maye Quade's Senate File 1048. We'll be laying that bill over in this, for possible inclusion in the omnibus bill. So.
Thank you. And Mr. Chair, if I could move the A2 amendment.
Senator Abler, do you?
No, I can move it.
Oh,
I'm on the
yeah,
committee.
go ahead. Yes.
Thank you.
All those in favor of the A1?
A2.
A2 amendment, say aye.
Aye.
All those opposed? Amendment passes.
Go ahead, okay. Your enjoyment of nonverbal cues is difficult to read sometimes, Mr. Chair. Thank you.
Share that with a member of my family.
So thank you, Mr. Chair, members. We have Senate File 1048, which is updating and clarifying the existing statute for education programming on sexually transmitted infections and diseases. With rates of STIs and STDs remaining high in Minnesota, it's important that the statute defines clear and achievable education requirements for districts to provide Minnesota students with medically accurate information to make informed and healthy decisions. So this bill does four things. The bill replaces technically accurate with medically accurate. The word technically is meaningless in this context, and schools and students deserve a statute that is clear and discernible for this required programming. Second, the bill removes the phrase until marriage from the abstinence coverage requirement and includes or subs in gains knowledge of other methods of preventing STIs. Abstinence is an important sexual health skill for people regardless of their marriage status or plans, and we also know that many people have sex outside of marriage, and it is a disservice to students in our broader community health to restrict STI and STD prevention educations to abstinence. Third, the bill states that this education programming should be inclusive of students regardless of their protected status under the Minnesota Human Rights Act, which we also define in the READ Act. And finally, the bill strikes language that dictates that schools target students who they think are at risk of and should receive STI and STD information. This is unnecessary targeting of students and should not be required in this statute. We have a responsibility to our students to ensure that educators are able to provide medically accurate and relevant instruction on how to prevent STIs and STDs. And with that, Mr. Chair, I will turn this over to my great testifiers.
Thank you, Senator. First up is, Meg Bartlett Chase, and then Steve Chapin, Liz Schultz, Newton, thank you, and Rasana Mamdani. Those are our four testifiers. So whenever you're ready in that order, identify yourself for the record, and welcome to the committee.
Perfect. Thank you, Chair. Hello. Thank you, Chair Swedzinski, Vice Chair Maye Quade, and members of this committee for allowing me time for me and so many incredible folks to speak on Senate File 1048. I am Dr. Meg Bartlett Chase. I'm a doctorate of education policy, a former classroom sex education instructor, the founder and executive director of Honest Sex Ed Minnesota, and a member of the National SECA Sex Education Policy Action Council. I'm here today to ask all of you to vote in favor of Senate File 1048. When it is there is opportunity in the omnibus vote, as well as supporting it today, to ensure future Minnesota students receive the STI education that they need, they want, and they deserve. I'm going to keep my remarks very short because when you or any government body makes a decision about sexual health education policy, it should be directly informed by those most affected, which is students, teachers, and families. You will hear from representatives of each of those constituencies today, and I hope that between their stories, the fact that this policy carries no expenditure, and the small but impactful wording changes, you decide to support Senate File 1048. What I will quickly say is that if Minnesota has a statute that defines and requires STI education programming, it does matter that that statute actually delivers the clarity and information needed for districts to successfully implement instructions that prevents STIs. And does so with facts and medical accuracy, not whatever someone might consider technically accurate. As it stands, the statute fails to do so, but Senate File 1048 would change that. Thank you again, Chair, Vice Chair Maye Quade, for championing this bill. I ask you all to listen to the coming testifiers.
Thank you. Thank you.
And Steve is.
Is Steve next?
All right, can you hear me?
There he is.
Perfect. All right, thank you, Chair Swedzinski, Vice Chair Maye Quade, and members of the committee for time to testify on Senate File 1048. My name is Stephen Chapin. I'm speaking to you today from my classroom at St. James High School in St. James, Minnesota, where I'm an 8th and 10th grade health education teacher. I'm also the 2023 Minnesota School Health and Physical Education Health Teacher of the Year. I'm a member of the Minnesota Department of Education's Health Standards Development Committee and a co-author of a health and physical education newsletter that goes out to over 375 teachers across Minnesota each month. I'm here to ask for your support on Senate File 1048. As a health teacher, I provide instruction on abstinence, consent, reproductive anatomy and puberty, STIs in pregnancy, and healthy relationships. In addition, I teach about mental health, nutrition, drugs and alcohol, preventing diseases, CPR, and many other topics. Of all of the topics I just listed, only one is written about in state statute with so little guidance and clarity. We know that education on a sexually transmitted infection helps students know the risks associated with contracting and spreading them. But fear-based education focused only on abstaining from acts that may result in the spread of STIs is harmful and well below the standard of best practices in health education. Abstinence is an important skill, which is why it remains in the statute with changes proposed in this bill. But it is not the only skill students may need to use to prevent STIs. Educators and school leaders are not legislators, and we are not often in the room where language and word choice discussions are made. I'm happy to be here today using my voice because the language in these statutes matters. As it stands, the statute is unclear and hard to discern what implementation should look like in school districts and classrooms around the state. Additionally, this statute is directly referenced in legislation for our statewide health education standards, which I am developing along with 30 or more other students, educators, and community leaders across Minnesota. As I've worked on this health standards process, I've realized the value of statutes that create and support our instruction with students and teachers. My number one goal is to create a future of teaching responsible health education in Minnesota that actually meets teacher and student needs. While the committee works within our charge, statutes like this one establish a legislative scaffolding of what we must cover and include. Today, you can help ensure that statute gives clarity and achievable goals to our teaching and standards development work. Opponents to legislation like this often claim local control or differing community values as reasons to vote against bills like Senate File 1048. But I want to interrupt that train of thought right there. My community supports honest, data-driven health education. I know this because in over 30 years of teaching sex education units, only 2 sets of parents had opted their kids out. And this isn't isolated to St. James. Many teachers from around Minnesota share the experience that very few students are being removed from this unit despite the option always being made available. Teaching about STIs in my classroom is not scary, it's honest. It is a simple data-driven belief that while we teach abstinence and encourage family communication, medically accurate terminology and STI education, including and beyond abstinence, must guide our instruction for the healthy futures of our students and our communities. A bill like this would clarify the language for educators, address students' health needs, and show tangible commitment to the health of Minnesota's young people. I want to say thank you today for hearing my testimony. I hope that you vote in favor of Senate File 1048. If you have any questions, please feel free to ask now or at any time in the future. I'm always available. Thank you.
Thank you, Mr. Chapin. Will you be able to stay on the call through so we can, if somebody has any questions for you?
Absolutely.
Okay, thanks.
Thank you, Chair. Thank you.
Thank you, Chair Swazinski, Vice Chair Maye Quade. Oh, thanks for the microphone, too. For the record, my name is Elizabeth Schultz Newton, and I am here today as a proud parent of 2 Delano High School graduates, and I encourage you to vote in favor of Senate File 1048. As parents, we do our best to teach our children what they need to know in order to take care of their health, well-being, and safety. As a parent, I also know that we are not all experts in sexual health and educating about sexually transmitted infections and their prevention. In this space, we often rely on teachers in our children's health classrooms. I believe the very least we can ask for is that the information shared in these classrooms is medically accurate, inclusive, and includes a variety of ways for our kids to learn about their health. This knowledge will build a foundation for our children to make a lifetime of healthy choices. I don't just speak for myself here today. I speak for the vast majority of Minnesota parents who want our kids to have medically accurate sex education in schools. In fact, a study from researchers at the University of Minnesota found that 90% of parents in Minnesota, your constituents, support the very same language proposed in this bill, medically accurate. When I think about the importance of sexual health education for all students in Minnesota, the existing language of technically accurate is frankly embarrassing and insufficient. Health education in this state should provide students with the knowledge and skills they need to keep themselves healthy and safe. And sexual health is no exception. When our children have access to a computer or a smartphone, we are allowing them access to unlimited information. And as we all know, sometimes that information is not always accurate. In a world full of misinformation, let's not let our classrooms be one of those places. Let's set our children up for a lifetime of excellent sexual health. I urge you to vote in favor of Senate File 1048. Thank you once again for your time.
Thank you, Chair Swedzinski, Vice Chair Maye Quade, and the members of this committee for allowing me to speak on Senate File 1048. I'm Rasana Mamdani. I'm a junior at St. Paul Central High School, a peer sex educator, and a youth member of the Health Education Standards Development Committee. In my experience as a young person, I know that all Minnesota students do better when they have access to accurate information about STIs. Access to information about how STIs are spread does not harm students in any way, shape, or form. During one of my classes, a teacher led a lesson on STIs where she ranked them from worst to best, with herpes listed as the worst. She said that herpes was a very dangerous disease and that not informing your partner of your herpes status would change their life forever and cause them a great deal of pain and suffering. After she said this, she said, all other STDs, you should go talk to a doctor and they can probably help you get that figured out. And that was all she said about sexually transmitted infections. This lesson was not medically accurate or inclusive of all the students in that classroom. Requiring medically accurate STI education would keep students from having to face educational experiences like these. Existing policy allows students' education to be shaped by one person's own beliefs and convictions about STIs. Her convictions were technically accurate. They were accurate to her understanding and values, but her statements did not reflect medically accurate courage and current knowledge about herpes. If this lesson had been conducted as Senate File 1048 would ensure, she would have equipped students with information about the forms of STI prevention, abstinence, barrier methods, testing, vaccines, and communication with partners. And the students in that classroom could have been confident, knowledgeable, and safe to make their own health decisions. Minnesota students want and deserve to learn all the information they need to make educated, relevant choices for themselves and their own health. We are not scared of hearing the ways we can keep our bodies safe, nor does this information inspire students to run off and have sex. In fact, medically accurate education on STIs have been found to actually delay young folks' first sexual experience and increase their confidence in taking care of their own sexual health when they do decide to become sexually active. When students are given these tools to take care of their bodies, they are allowed the opportunity and space to grow into mature, well-rounded, informed adults. Students want to learn these things, and we deserve medically accurate knowledge about how our own bodies work and our own health. Thank you, and for the benefit of all Minnesota students, please vote in favor of this bill.
Thank you. And again, I'll just echo what Senator Miller said. You're very brave and courageous for coming down today as a student before this body, so thank you. Members, questions, comments? Senator Duckworth?
Thank you, Mr. Chair. I appreciate it. Again, just a quick one for Senator Maye Quade. Have any of the school boards, has the association given you their thoughts or anybody given you their feedback sort of on this bill and how it might be implemented in their districts, or has there just not been an opportunity for that yet?
Thank you, Mr. Chair. Senator Duckworth. So currently the state is undergoing, for the first time in about 20 years, statewide health standards. And so that is already an ongoing process. So this would just update I guess, the direction about what those health standards would be, because it does refer back to this chapter. So I have not heard anything specifically from districts.
If I may, Mr. Chair. Thank you. I appreciate that. Obviously, at their level, the school boards are going to be ones to read the law and implement, make sure they're following it. And I know there's already a part currently in state statute that says what will happen if they don't do that. That's also important. If this bill were to pass and make some changes that they're then going to have to accommodate, I would just hope that they're given time to make the changes they need at their level, whether that be to instructional materials or what have you, not have it necessarily be an immediate one, but something that they can plan for. I guess I appreciate the conversation surrounding the word technically versus medically and scientifically accurate. I guess my interpretation of that is that I don't think you have school districts or teachers out there purposefully trying to teach this topic in a way that necessarily isn't accurate or somehow leaves out important or vital information. But if we're getting feedback that there are better ways to teach it or more encompassing ways or other things that should be covered during this instruction, that's a worthwhile conversation. That's all I've got, Mr. Chair. Thank you.
Mr. Chair.
Hey, Senator.
Thank you, Mr. Chair. And Senator Duckworth, I appreciate that. I will say that one thing that I've heard from a myriad of folks, whether it's parents, students, teachers in districts, is that the lack of statewide health standards actually left it up so much to like an individual or several individuals, and the lack of guidance around medically accurate, unbiased, again, like left a lot of room for more things than information, and that actually made parents and teachers and districts really uncomfortable. And so I think we're actually getting into a place where like this is information, the values around it is what students can discuss with their families or whomever, but not with their teachers. And this is actually helping kind of clear that up. And so I think it's going to lead to more information, but actually better feelings about this as it moves forward too.
Thank you, Senator. Anybody else, members? Okay. Thank you for bringing this bill forward. Thank you, testifiers. Is that the gentleman from St. James still on?
Yep.
Can you share with the committee and the people of Minnesota why you think you were given the distinct honor by your colleagues and students of being Teacher of the Year for your particular curriculum?
I think the simplicity of it is hands-on experiential learning and crossing some really honest conversations, but really getting my students out of the classroom, as you stated in the previous bill, and connecting that to real-life learning. And part of this is about real conversations. Part of this bill is really about how do we help students have those conversations, whether they be with parents or partners or bosses or whomever. And part of my health class is really about experiential, getting kids out doing those things. And I think that's part of it. I guess the innovation and community stuff is maybe part of it as well. But got a great place to teach here in rural Minnesota, and super excited to carry this work on, and appreciate the opportunity today.
And congratulations again. I know that it's quite an honor.
Mr. Chair.
Thank you very much. Appreciate it.
And Mr. Chapin, this is Senator Maye Quade. I just want to say thank you so much for coming. Since I won't see you in person, I wanted to thank you for all your work.
Yeah, I appreciate the work you guys are doing on your end as well. So thank you.
With that said, Senator, we're laying this over for possible inclusion in the omnibus bill. Thank you for your testimony.
Thank you, Mr. Chair.
We're gonna, Senator Mann is stuck in Judiciary Committee, so we're moving on to Senator Mitchell's bill, Senate File 16. Welcome to the committee, Senator. Whenever you're ready, begin your testimony.
Thank you, Mr. Chair and members of the committee. This is a bill that was actually presented last year, if you might remember it. It was held over and it was actually included in the Senate version. It did not get through to the end because of the health standards that were going on and kind of a decision that instead of making another law in that way, that we would try to add it in through the health standards curriculum. This was an idea, abuse in their home. And so basically it is that we would add in education on, there's already an option for sexual abuse, but also add in physical abuse to our education and possible curriculum because, and I can say this as someone who's done a lot of advocacy work with abused and neglected children, sometimes if that is what they are being raised in, they don't understand that it is what is wrong and that they should talk to someone about it or anything else. So if we can add more of that opportunity for them to kind of know what isn't right at home or with anyone else, they can better speak if they are able to. So I'm so proud of my constituent because the healthcare standards are being reworked, we, while also presenting it here, decided that we would present there to make sure it got included. She actually went the extra step of being one of 3 students in the entire state to be put on the board. So she is also working this from the inside, but we wanted to make sure that if for some reason it doesn't end up there, we are also working it from the statute level to include this very important education. So kind of with that setup, I would actually like to turn it over because she did a lot of the work, met with a lot of the partners with a little guidance from me, but it was mostly her and her story, and I want her to take that credit.
Begin and identify yourself for the record.
Good afternoon, Senators. I'm Anura Venkat, a junior at Eastridge High School in Woodbury. And to start, I just want to say that the reason I'm able to be a focused student at school and live a happy and healthy 16-year-old life is because I grew up with a mother who let me make mistakes rather than physically threatening me when I did, and above all, taught me how to use my voice rather than taking it away from me entirely. But the experiences of a child who was very close to me growing up showed me that this upbringing is not a right in this world, it's a privilege. Because for 10 years, I watched as this child endured being physically abused by their parent who suffered from mental illness. And it was absolutely terrifying not knowing when asking a simple question or making an honest mistake would jeopardize the physical safety of this child. And no 5-year-old kid should ever have to live under that much fear and anxiety on a daily basis. And as this child has grown older, I have seen firsthand the lifelong implications on their mental and physical health. But without receiving the proper health education to know any better, my mom and I were told 2 things that discouraged us from reporting the abuse. First, that reporting the abuse would rip this child away from their parents, altering this child's life for the worse. And second, that this was normal means of discipline in an Indian household. As I grew older, I stopped waiting for a doctor, relative, teacher to tell me what was going on was not okay and started doing some research of my own. And I quickly realized I had been misinformed because in reality, the first thing that happens after you report a case of child abuse is not family separation. That's a last resort, but instead, CPS devises a service plan to support the family with resources meant to prevent future abuse. Meaning, if we had reported the abuse, perhaps the perpetrator may have received mental help to reduce the risk of abuse reoccurring. And yes, while there is gray area when it comes to defining child physical abuse, in a household where asking a simple question can literally physically threaten a child, it's simple. There is no question to be asked. The child needs protection, safety, and the abuse should be reported. According to the National Children's Alliance, every day 5 more children in this country lose their lives due to child abuse and neglect. The very least we can do is ensure that every student in the state of Minnesota receives the education they need to protect themselves and those around them to the best of their ability. And that's exactly what this bill does and why I think it needs to pass. Thank you.
Thank you. And we have one final testifier remotely.
Yes.
Yes.
Begin your, identify yourself for the record and begin your testimony. Thank you. Welcome to the committee.
Thank you. Good afternoon, Senators. I'm Marcia Milliken. I'm the Executive Director of the Minnesota Children's Alliance. Our coalition comprises of children's advocacy centers and multidisciplinary teams dedicated to protecting and advocating for child abuse victims and their non-offending caregivers. I wholeheartedly support Senate File 16, a transformative initiative mandating the integration of child physical and sexual abuse prevention education into school health curricula. Child abuse is a harsh reality with enduring effects. Research reveals that 1 out of 10 children will be a victim of sexual violence before turning 18. And 18% of maltreated children are physically abused. To address these alarming statistics, our educational system must proactively equip students with the tools to identify inappropriate or unsafe touches. Recently, our organization conducted a national study on child abuse prevention grounded in research-informed practices. The findings underscore the importance of the bill's key elements, that child abuse prevention is an ongoing process. It needs to be multi-session curriculum, and it also needs to ensure there's cultural inclusivity and it is developmentally appropriate. Prevention programs and body safety education not only raise awareness, but also foster vigilance among students, educators, and parents against potential abuse. Empowering the entire school community with information and resources enables them to recognize, report, and effectively prevent abuse. Another critical provision of Senate File 16 is a requirement for school districts to train instructors on managing disclosures during child physical and sexual abuse instruction. Research underscores the pivotal role of adult responses to disclosure in a child's healing process. So it's really important that those that are hearing the disclosure, that they know how to handle that. The impact of child abuse extends beyond immediate victims to the entire school community. Implementing comprehensive prevention programs is both a moral imperative and a strategic investment in our children's health and success. Our educational system must actively equip students and educators with tools to identify, prevent, and respond to instances of abuse. Prevention instruction can have on the safety and well-being of our kids. Integrating such education into the health curriculum empowers students and contributes to creating a safer and more informed society. Thank you for your attention and your consideration.
Thank you, Ms. Milliken, and Ms. Van Cat, thank you as well. Members, any questions or comments? Senator Abler?
Well, thank you, Mr. Chair, and to Ms. Van Cat. I think you, we don't have the award, but I'm making up a new one, the Testifier of the Week. You were profound, and I'm sad that you could be so profound, and so thank you for being here. Actually, Mr. Chair, this is a worthwhile bill. I think will do some good, and I'd like it, and maybe if the Senate will allow, I'd like to co-author it, so thank you.
Thank you.
Senator Maye Quade.
Well, thank you, Mr. Chair, and Senator Mitchell, I appreciate you bringing this bill, and specifically to your testifier. It is so hard for grown adults to come and talk about the most boring subjects, and you came and just told a very, very personal story so beautifully and so compellingly, and your friend is such a lucky person to have you in their life, and to be able to advocate so fiercely for them. Senator Mitchell, this is such a good bill. I was in the House when we passed, it's Aaron's law, but it's not me, it's a different Aaron, and it was to encourage districts to integrate, Senator Abler's law apparently, to integrate and offer instruction on child sexual abuse. And so often our bills are big, the big meaningful bills, right? They're thick, there's many pages. And with one change of encourage to require, it is life-changing. It is absolutely life-changing. And so, and including the other things too, physical abuse and how you identify that, what the effects are. But I wasn't a parent when we passed this law in the House, and even then I was like, but how would they know? And I have a kid now, and she doesn't really know any other houses except our house. She thinks that in every house you know, Pooh Bear, where she runs around the house and no pants on, right? She thinks that everybody does that. But, you know, kids deserve knowledge about their lives, and they can't talk about what they don't know, if they don't have the language, if they don't understand. And so this is just so meaningful, and I'm just deeply, deeply appreciative of you bringing this and for having such a compelling constituent to come back year after year. A lot of adults give up, and you're not. So this is just incredible. Thank you.
Senator Kunish.
Thank you, Mr. Chair. I wasn't here for all of these health-related discussions, but I think it is absolutely important that we talk about this and we require this in our school system. The first couple of years of my teaching career, I was a 6th grade teacher, and I drew the short straw on being the health teacher. And part of that curriculum was about, you know, the anatomy of human beings, the male and female. It touched some on reproduction and those sort of things. But when we started that unit, kids had so many questions. They had so many questions that we just sort of take for granted, or I thought, you know, at 6th grade, I didn't know the answer to that question. It was as an adult these things came to me. And so I created a question box where students could just put questions in there. They didn't have to ask them out loud. They didn't have to put their name on it. But the questions that they asked were so mature and so personal. And they, you know, I know that some of those questions were being asked for somebody else that they knew, a friend of theirs that was in a situation but didn't want to, was so scared or unsure of asking that question out loud, what the answer might be. And, you know, so much of this around adolescent sexuality, human sexuality, you know, for, you know, especially my generation, the generations before was just taboo. You didn't talk about your bodies. You didn't talk about reproduction. You didn't talk about choosing to be pregnant, not to be pregnant, birth control, all of those sort of things. And it doesn't do us any good not to learn about it and not to talk about it and to not have somebody safe and trustworthy in our schools to go to get true, scientific, authentic, medically correct information. And so when we have that opportunity, and I know our schools don't like unfunded mandates, they don't like mandates anyway, this is something that is going to support and build the strength of the individuals, whether they're young girls or young men. And in this day and age, when there are so many predators out there, we need to make sure that there are opportunities for our children, our students, to find a trustworthy adult to go to and ask the questions and also be able to share their stories and ask for help. And so anytime we have that opportunity, I think it's really important that we support it.
Thank you, Senator. That was for Senator Kunish. Thank you, Senator Mitchell. I just want to again thank another student today. I started thinking during your testimony that there was a teleprompter behind me because you were so eloquent and just rattling off your soliloquy, and so thank you. It sounds as if the last two bills we've heard, maybe it's time for us to start reevaluating our health curriculum here in Minnesota. I don't know, that's for another day, but thank you both, the previous two senators, for your bills today. So final thoughts or questions or anything, Senator?
Yes, thank you. So, you know, the health standards, the first draft just came out late last night, and it is now the public comment period. So I really appreciate the robust conversation today because that's something we can bring back also into that process while we also work on this process for that possible inclusion. I'd also like to give my wonderful community member one other just compliment, is that when we were all working and all of the members were at the table for this, to some of the points that were made, we already had what I would call a complementary bill passed last year that was at some of the schools and other places with mandated reporters. We were hearing stories that people above them in administrations, schools, hospitals, whatever, would sometimes quash the reports and encourage people not to do the mandated reporting, and so we changed that so that hopefully if a child ever does come forward, possibly now that they would have the education on how to do so, that those reports would be taken seriously and never kind of put off to the side. So hopefully we're doing everything we can in this state to make sure children have the best outcomes.
Again, thank you, and we'll lay this bill over for possible inclusion in the Ed Policy Omnibus Bill. So thank you, Senator, one last time. Thank you as well. Next up, Senator Mann. Senate File 2390. Whenever you're ready, Senator.
Oh, I'm ready, Mr. Chair. Thank you, Mr. Chair. Members, Senate File 2390. I hope today will set the table for us for a very robust conversation. Today, individuals are allowed to submit requests for data from our schools. There are very legitimate reasons why someone would want to request data and why schools should have this public data available. However, we are running into some trouble when people are making data requests that are costing schools $7,000, $20,000, $400,000, over $1 million collectively. Can you imagine how many school counselors we can hire with that kind of money? One example stood out to me was a data request from a school as to how many times the word consensus was used in all communications. So right now, schools can charge the requesting person for cost of making copies, but not for the staff time or any other costs incurred. And many times, these large and cumbersome requests are done by anonymous people who never show up to collect the data that they requested. So I hope that Senate File 2390 will be a starting point for us today, because we do want people to have access to legitimate data and to have their requests be protected, but we also want our school staff not to do frivolous and wasteful work, and we want to protect the budgets of our schools. With that, Mr. Chair, I do have a amendment, an author's amendment.
Is it the A2?
I believe so, yes.
Senator Mann offers the A2 amendment. All those in favor say aye. Aye. All those opposed? The amendment carries. Senator, continue. We have three testifiers, 2 remotely. So John Carlson, you're up first.
Great. Thank you, Chair Sadwinski and Senators, for having me here today. My name is John Carlson. I'm the Chief Administrative Officer of Rochester Public Schools. I'm here today to support Senator Mann's legislation to impose charges for abandoning requests that consume limited staff time and resources. It's no secret that school districts are struggling right now to keep the staff they have. While we are cutting teachers and education support professionals, regretfully, we recently added a new central office position called Data Clearinghouse Manager, at a cost of roughly $100,000 per year for salaries and benefits, about the same cost as one teacher. This noticed a steep uptick since the pandemic. I want to very quickly summarize for you 3 main categories of what we are seeing for data requests right now. First, we have what I call good, narrow data requests that help provide transparency to operational decisions or financial transactions, whether it be around a contract or a specific payment. In my opinion, these data requests meet the intent of the writers of the Minnesota Government Data Practices Act. We are very happy to respond. Second, we have what I would call commercialized requests that seek all information about purchase orders and checks written so they can sell or data mine our financial information for their gain. We have no relationships with these companies and don't know who or where they are located, but they know how to write a good data request and make money off us. Third, we have what I call phishing expeditions that are broad, hard to interpret, and sometimes from anonymous persons or politicized entities that want all emails or electronic files or textbooks or pieces of paper that might contain a certain word. These data requests can take weeks to months to fulfill, and it may be for nothing if the request was made anonymously for inspection, and then that anonymous person does not show up to inspect the data, which has happened. I want to commend you for investigating this issue and allowing us to be able to charge costs if someone puts in a large data request but then never shows up to review it. This is a great step in the right direction, and we urge you to consider adopting this addition to the current statute. I also want to strongly support no anonymous data requests, even though I know there is an amendment to remove that provision. It would not be possible to figure out who to charge if we prepared a significant amount of data for inspection. There was never a name tied to that request, but rather they just kept simply emailing saying they would come in and inspect it. Thank you for your time today and for considering this proposed legislation.
Thank you for your testimony. Next up, Mr. Enger, remote.
Yeah, can you hear me?
Yep.
Okay. Again, Chair Szynski and members of the Education Policy Committee, I appreciate the opportunity to address you on this issue. I'll give you a little reference. I'm at Plainview Elgin Millville. I've been a educator for 36 years. I retired and they weren't able to find a superintendent, so I came back out of retirement to be an interim for this past year. So we're just a little north and east of Rochester, much smaller. And prior to retirement, I was a little further down the road at Lake City. So this isn't just a big school district problem. It is definitely in rural Minnesota as well in our districts, because I dealt with it both in Lake City and at Plainview, Elgin, Millville now. So as John mentioned, first of all, we're all about transparency. A lot of the things that I do as a superintendent these days, they end up on Facebook with someone taking a screenshot of my emails and that sort of stuff. Totally understand that, but we're able as a smaller district, we will never have, I think John said he's a director of house collection data at 100 grand. That's going to fall under me and other folks. But we can navigate smaller districts through most data requests. Even the vendors John's talking about, we get them as well. Those are things that I can do within the district. The area that we run into that gives us a lot of problems is the emails and people requesting sometimes an ungodly, they want to go back 2-3 years an issue. Recently, you may follow the paper, PEM non-renewed a longtime coach. We had data requests going back 2-3 years when it started in that community. That's thousands of dollars. They did pick it up, but I just think, and where does the cost come in for us? It isn't so much the emails. If that's all I had to do, even as limited as of tech services that we have, most of our work is just focused on keeping our kids and our devices up and running. But it's in the redaction, the cost of making sure whatever I'm sharing with them isn't a mistake on the district part and open us up to some sort of a lawsuit. So I have no problem with transparency, but I also think if you want something like that where there's a cost associated with it, I think we should be able to charge you for the redaction fees. Someone mentioned, it's a counselor. Well, even thousands of dollars, that's more than some of my elementary teachers receive for a budget for a year. So it's just frustrating, a little challenging to see in some of these areas how, in the eyes of transparency or someone's thoughts, what we're encumbering for cost, and that comes all out of our general fund. So, I definitely hope you guys take a look at this bill and would support it. And again, it isn't about transparency. It's about if something's going to cost us, the school district, to produce it, just making copies of it, that's not going to help us. So thank you for your time. Thank you for what you do. And I hope you take a good, close look at this bill.
Thank you, and thanks for coming back to help your community from retirement. We have one final testifier. Rich Neumeister, come on up, identify yourself for the record.
Madam Chair, or Mr. Chair, members of the committee, my name is Rich Neumeister. Has the amendment been adopted? Okay. As you may note, you have testimony, which I gave a number of you. That is based on the amendment. So the concerns I have still are out there. One of the things I think you have to understand is that the more that government is involved in our lives, particularly entities such as school districts, over the years and more things happening, people want to know more. Why? How come? Situations like that. I've helped many people, parents, who are trying to get access to information about their kids, themselves, or whatever in school districts. School districts can be sometimes tough, not wanting to give the information to people. The bill before you with the amendment is still not good public policy, as I stated to you in my email. What I want to do is refer to some of the testimony. For those people that, and I've done this for decades, and I've helped many of your colleagues over the years. If, let's say you get an anonymous request asking for every email that has the word something in it, the law already allows you the flexibility not to get it right away, but okay, let's sit back, take a breath, and then do like a rolling production. Now, Hennepin Anoka has a good policy. That's what they do. So when they get a big request, they'll say, okay, let's do a rolling production, whether it is with someone they know or someone anonymously. And they'll probably put some of that out. If they don't come to it after that time or another time, the law already allows you the flexibility not to do the rest of the request. And that's where, when you deal with these dynamics, you have to take a look. It's because of ignorance, not ignorance in terms of a negative, but because of lack of knowledge. Lack of education, lack of understanding of what the law does. And so with that, Mr. Chairman, the other point that I wanted to make is that, you know, like, for example, it was the $400,000 or $300,000. Owatonna has been used as a dynamic. But the question is, how much went to that of lawyers' fees when other comparable school districts will train people up front to where they don't have to go to the lawyer for everything? So is it the lawyer that controls that dynamic? This sets a bad precedent. So that's one of the questions. How much do school attorneys drive the cost? Data management. This has been law for almost 50 years. And since 1941, from the Official Records Act, entities need to have their data accessible for convenient use. So if folks are not either making sure that they're complying with the law in the first place, and number two, if they're not doing training how to handle these kinds of requests, what happens, they get in a panic. And the second testifier was saying, oh, we want to recoup costs. This bill has nothing to do with recouping costs, because even with the amendment, what the amendment applies basically is going to go after anonymous folks. Are you going to send them an invoice? Are you going to have a collection process on an anonymous person? The bill as is sets a standard that is innocuous. And secondly, yes, it may be a good start, but another body, which is attached to the building across the street, knew that there were a lot of issues here. And so there's a lot of things to be discussed. all I'm saying, Mr. Chairman, as I wrap up, is I pride, and all of you pride, on people to be able to have access to public data to know what's happening with the entity, their school districts. I think there's a better approach than what we're doing here. And so my suggestion is to lay over the bill, and let's have some good discussions with all of us being informed, because as you see at the end of my written statement, I said we have to think, talk, and let's all get together rather than talk at each other, but talk with each other. Mr. Chairman, members of the committee, that's my 2 cents, and I'm open to any questions.
Thank you for your testimony. Okay, Senator Duckworth.
Thank you, Mr. Chair. I appreciate it. And I just have some thoughts on the bill that I'll offer just for the sake of the author maybe to consider as she continues to work on it. You know, I'm sympathetic to where Mr. Neumeister is coming from in terms of the importance of having the ability of the public to access data and be transparent, et cetera. However, having served on a school board, I've seen what I would characterize as it being used and abused at times. And I think the aim of your bill, not to put words in your mouth, but this is my interpretation of it, is to try to discourage frivolous requests, especially those that can cost school districts and ultimately taxpayers a lot of money. When I look at some of the language of the bill, specifically between lines 1.15 and 1.17, I think it's entirely appropriate that you would request the identification of the person making the request. And I honestly would encourage you to maybe be more specific and ask for a person, because sometimes you just get the name of an entity. It doesn't actually lead to who is requesting it. In addition to that, you might also want to require them to share what purpose or reason why they're requesting that data. To me, that seems like not an inappropriate request to make or information to have as well if someone's going to be requesting information from the school district. I think you might also give some consideration to, especially when it comes to the monetary aspects of the bill, if the request is coming from or on behalf of a resident of the school district versus a non-resident. You may or may not choose to favor or be a little bit more lenient if it's a person that's actually a resident of the district and likely has a very valid reason for asking versus someone who's not a resident of the district asking for who knows what reason. I think it's no secret that sometimes there are very nefarious or very politically motivated reasons why sometimes these requests are made. It could be a school board member, or sometimes this applies to city council, or you name it, decides to run for political office. And all of a sudden, you've got some multi-million-dollar political operative firm in DC making a massive data request to a school district to the tune of thousands of dollars. Well, that firm, if they're going to be using it for the reasons we can probably guess why they intend to use it, should be paying the cost for that information, not the taxpayers of the local area, my humble opinion. So I think if we take the intent of the bill at face value and the perspective and feedback we're getting from districts, and also trying to balance it against those who are proponents of transparency and having access to this data, I think you can strike a balance in a bill that still allows for that information to be produced in a timely manner in instances in which it's warranted, are in good faith to people of that community who it's particularly relevant to, while also making it known that if you're just going to make frivolous requests for unknown reasons or perhaps nefarious ones, we're going to require you to share some information about who you are. And if at the end of the day you're just going to stand up the district and not collect all the information you just required, and they spent a lot of man hours and money producing for you, you better believe they're going to have the ability to charge you for it. That's all I've got, Mr. Chair.
Thank you, Senator. Members? Senator Abler?
Well, thank you. I'm not the expert on this like Mr. Neumeister is, and if you haven't become familiar with him, he is like one of the few extremely long-standing volunteer lobbyists working for just the people that are out there that on terms of data privacy, data practices, people's right to know. If there is a plaque for someone like that, he should have earned it a long time ago. So I just urge people to listen to his concerns. And I think everything that Senator Duckworth said is sensible enough, if only the world were fair. There are some things that on the anonymous question, which is taken out, and I appreciate that. I think that's problematic. But there's a time when a person needs to be anonymous. They're a district employee. It's a sensitive topic. And I don't know how you resolve anonymous people not showing up. I mean, that's an issue. But I think his comments, I can't repeat them any better than he said. They're valid. And you want this to actually work. And Senator Mann, you're as good an author on a topic like this as anybody. And I think if you want to accomplish a product at the end of this session on this topic, I think that could be done with a little help from people like Mr. Neumeister and others. I just was informed that this bill was heard in the House and it was laid over. And I think that there is room for a consensus. There probably, if you know how the world is going on over there, there's one bite at the apple and then they're moving on to something else. And so I think there is a need to control costs and be fair to people. But I don't think a person should have to say why they want something. They just get to know, especially in a world where the meetings are more and more, where the content is more and more removed, and oftentimes much more controversial than it once was, where people have, as you well know, divergent points of view on the same topic and things they just simply want to know. There was a situation, I don't even know if it fits to this, but I mean, was it Bloomington, that there was something about content somebody couldn't get, and then they were going to give it to them, and they weren't, and all that. So my advice to you is similar to Mr. Neumeister's, and well-intended, that just keep working on this. This is a safe place to have it go, just to stay, and I'll help you if you want, but thank you, Mr. Chair and Senator.
Thank you, Senator. Council, do you have an amendment suggestion?
Yes, Mr. Chair, members, on line 1.9, after independent, insert comma, common, comma, because there are also common school districts in addition to independent or special school districts.
Acceptable? Okay, all those in favor of the author's or council's suggestion, say aye. Aye. All those opposed? The motion carries. Any final comments, Senator? Okay, we're sending it to Judiciary.
Mr. Chair.
We're voting to send it to Judiciary. Senator Abler?
Well, not to reiterate all my comments, but I think everybody, I don't know, I haven't talked to Senator Mann about this, and I don't want to sabotage anything, but I think just reflecting that it's a work in progress, if she would accept it, you would accept without recommendation, then people would know that we care about it, and I would vote for that. So thank you, Mr. Chair.
Okay, we're going to vote to send it to Judiciary. All those in favor say aye. Aye. All those opposed? I think we're not accepting it, Senator.
Mr. Chair, you didn't say you didn't accept it. So, I mean, can we vote on that motion and then we'll vote on the other one? But if you want to get some, do it how you want. I'm trying to work with people here,
yeah,
Mr. Chair, and this is more controversial than you realize, and I'd like to, so I mean, so that's why
The motion to lay it over?
No, to move it without recommendation to Judiciary.
Oh, okay.
If you would accept that verbiage. Okay. Thank you. I know I'm not trying to lay it over and to kill it. Thank you. So, Mr. Chair, I'll move that the bill be moved without recommendation to Judiciary.
And is the author of the bill okay with that?
Sure, yeah.
Okay, all those in favor of the way Senator Abler suggested it and Senator Mann has concurred she can live with, all those in favor say aye. Aye. All those opposed? The bill is being sent to judiciary. You're welcome.
Member.
And lastly, but not least, Senator Duckworth, Senate File 1670, last bill we have today. And there's one testifier. And whenever you are ready, Senator, and I know you have the A2 amendment.
Thank you, Mr. Chair. I'd like to move the A2, please.
All those in favor of the A2 amendment, say aye. Aye. All those opposed? Motion carried.
Thank you, Mr. Chair. I appreciate the opportunity to testify before you. I'll be short and sweet. This is a bill that may look familiar to some of you. It's one that did pass off the Senate floor a few years ago. The gist of it is it tries to increase the accuracy of reports regarding teacher shortages in districts. And with that being said, Mr. Chair, I'd like to turn it over to Mr. Shaver, who can elaborate on the bill some more. Thank you.
Okay. Thank you, Senator. Mr. Shaver, whenever you're ready, and identify yourself, obviously.
All right, Chair Swedzinski, members of the committee, good afternoon. My name is Matt Shaver. I'm a Tier 4 licensed teacher, 3-time Teach Grant recipient, and the Senior Policy Director at Ed Allies, also a former student. Been a long time since I was in high school, though. We work on policy to support diverse and effective educators at Ed Allies. Thank you for the opportunity to testify in support of Senate File 1670 as amended. Thank you, Senator Duckworth and the bipartisan co-authors for bringing forward this small but mighty tweak to expand how we understand and measure the teacher shortage in Minnesota. To be crystal clear, there is definitely a teacher shortage here. Hopefully that's not a controversial position to take, but what is the teacher shortage? How are we measuring it? Is it getting better or worse? How do we know if efforts at the legislature are successful or not? Answers to these questions require a legislative definition and data. So for an example, let's say the members of this committee all agreed to take a trip together to the West Coast this summer, but you don't nail down where, when, or how you're going to get there. Senator Duckworth might pack for a road trip to San Diego. Chair Swedzinski might buy a plane ticket to Seattle. Senator Wiesenberg might buy a train ticket to Oregon. Senator Miller may have his sights set on Las Vegas. I'm sad he's not here for that joke about gambling. Generally, heading in the same direction, you'd all be generally heading in the same direction, but without an agreed upon destination or way to get there. And that's kind of what the legislature has done in addressing the teacher shortage to this point. Currently, the term teacher shortage is mentioned in 10 separate areas of statute, is tied to 7 different grant programs, the Teacher Shortage Loan Repayment Program, Student Teacher Grants in Shortage Areas, Alternative Teacher Preparation Grant Program, the CTE Consortium Grants, Teacher Mentorship and Retention of Effective Teachers, the Come Teach in Minnesota Hiring Bonuses, and QComp, and is only legislatively defined in 2 of those 10 areas. Shout out to the higher education statutes. In the other 8 areas of statute, the definition of the teacher shortage is left up to either Pelsby, the Commissioner of Education, the 1/3 of school districts that have access to QComp funds, or just left entirely undefined. Minnesota spends tens of millions of dollars annually on funding initiatives that are linked partially or entirely to the term teacher shortage. If you look at the handout included in your packets, you'll see there are 5 separate lists of teacher shortages with different authors that affect various policy and funding choices, and ultimately future and current Minnesota teachers and students. According to the supply and demand report, to measure the teacher shortage, Pelsby counts the number of Tier 1, Tier 2, and out-of-field permission teachers currently in the classroom, uses that to identify areas of shortage. So if a Tier 2 teacher leaves in the middle of the year, our shortage hasn't grown, it's shrunk. They don't need to be replaced. We just have fewer Tier 2 teachers, making our shortage on paper appear smaller. This is a limited measurement of the shortage because it doesn't incorporate data on vacancies and unfilled positions. The majority of the country uses teacher vacancy data to inform their understanding of the teacher shortage. States like Colorado, Illinois, Maryland, North Carolina, Tennessee, and Virginia all track at the agency level the actual number of vacancies districts are experiencing, which negatively impacts student learning and tend to be unevenly distributed in schools serving large populations of students of color and students in poverty. The data is collected in order to do something about those disparities, such as the example in your handout about Illinois. In Minnesota, we ask districts this yes or no question and report on it every 2 years. Did you have teacher positions that were budgeted for but were not filled due to lack of qualified applicants? All we know because it's all we ask, is that there were at least 101 unfilled vacancies in Minnesota schools in 2019, and at least 207 unfilled vacancies in 2022. We also know that the majority of responding districts feel like there are significantly fewer teachers available than 5 years ago. Again, this is all we know because this is all we ask. But we can't build good policy and design effective investments based on vibes and anecdotes. We need holistic definitions and comprehensive data, and that's what Senator Duckworth's bill does. Senate File 1670 does three things. It expands the definition of shortage areas to include unfilled positions, requires Pellsby to ask school districts how many unfilled positions they have instead of just whether they had at least one unfilled position, and they report specifically on unfilled positions in licensure areas that the student teacher grants and teacher loan repayment programs have focused on in recent years. And we strongly agree with what Pellsby wrote about unfilled positions on page 43 of the 2023 Supply and Demand Report. Quote, of greatest concern in conversations regarding supply and demand of teachers is the nearly 73% of districts indicating a position not filled. Senator Duckworth's bill will ensure there's more useful data on unfilled positions collected moving forward so we can measure the impact of policy and funding on the teacher shortage. I want to thank you all for your time today and for your public service to our state.
Thank you. Members? Any? Senator Maye Quade?
Thank you, Mr. Chair. And Senator Duckworth, I think this is a good bill. I'm glad it passed out of the Senate. I hope we can pass it and put it into law this year.
Thank you.
Great bill. Any final comments? And I appreciate the disaggregation of the data because it is pretty useless information. Just know there's a teacher shortage and we need to know where the areas are so that the schools and whatnot can better prepare the wonderful teachers to do their job. So Senator Duckworth, any final comments?
No, just thank you for the hearing, Mr. Chair.
Okay, it was an easy. We're sending the bill to Education Finance. All those in favor say aye. Aye. All those opposed? The bill motion carries. Coming in. Okay, everybody. This is my final announcement to my colleagues. If you have an idea for a bill or suggestion that you've been forgetful on, or too busy to put it together, I do believe next Monday may very well be our last committee hearing, because on Monday we've got about 4 bills, and then after that we begin the omnibus bill discussion and markup on the following Wednesday, the 28th, whatever that is, the 26th, oh, the 24th. We have our final, as the plan goes, our final day for bills, and I see that we have 5 bills that day, and then after those bills are reviewed, we'll start the omnibus process. The following Wednesday will be the markup day, and that's the plan. We'll see if it works. So although it'll work, still be hard. Although, thanks for coming today. We'll see everybody next Monday, and have a great rest of your week.